Let's orient ourselves a little bit so we kind of have a sense of what we're working on. Because if we don't have a sense of what we're working on, and we're not exactly on that tissue, then our release work, it may not be as effective. Okay, so let's orient ourselves to what's going on here in the lateral elbow. Well, our main sort of orienting tissue is our brachioradialis. And so we can get that to come out. So you bring your hand up to me, like this, I'm sorry, your arm and your hand. There you go. You see that pop out there? That muscle? So that's your brachioradialis. It's like a hamburger. Well, maybe not a hamburger. Kind of like maybe a hot dog in there. You can just pinch it, find it, okay? But push that over, and right there, okay, is what, if I go in there and I capture that, what is that muscle? Tendon. Because there's a tendon here that attaches to our lateral epicondyle, right? Okay? But it's a common tendon. So that muscle comes in here. So does a few others, okay? And they all come together into this sort of common tendon. However, we can isolate that particular muscle by pushing this brachioradius out of the way. We come in, we pin it, capture it, and then roll it over. Now, it shouldn't be tender, okay? But you said it was quite tender, okay? What is that right there? What do we call that? It's extensor, right? It's on this side. So it's our extensor carpi radialis. It's on our radial side. And up high, we're probably dealing with the longus. We get down here, a little more brevis. But I can tell you this, they're really hard to differentiate. So we just kind of treat them as a group. We palpate them as a group. So I'll come in here and I'll capture it and roll it. And you tell me how tender we are in here. And I'll go down to right about mid-shaft here. Okay, but then what do you say, Emily? What would you rate that there?
It's an 8.
An 8. And if I go up further towards the common tendon, and now I'm kind of coming up, I'm not on the epicondyle here. Is that tender at all? No, that's not tender. But where it comes off of that bone, right at the tissue interface, the bone-tissue interface, is that tender? How tender is that?
Around an 8. It's
an
kind
8.
of going up my arm.
It's going up the arm. She has some referred pain. So 8, 9, right? Yeah. That's what she had when she was standing up there. So, and I've just got my fingers really lightly on her, and I feel this boom, boom, boom. Almost feels like a pulse. But it has a different sensation, okay? We call it a fasciculation. It's not very regular. It kind of comes, it goes, has a little bit of a zing to it, okay? And so that fasciculation, you can think about it as like being a minute spasm. It's an aberrant neural activity of the tissue. Okay? And we're going to use that to guide us in what position we put her in, how long we hold her there for, and is she inflamed? Okay? Now, we've got a brachioradialis. I'm going to pinch that. Okay? Just like when we do the sternocleidomastoid or tissues that are sort of very, sort of ropey or tendons. So I'm actually just going to pick that up and roll it between my fingers and ask her, is that tender? We can also pin it down, but, you got to be right on top of it. And how tender are you there?
An 8.
And I'm going to go right up into, right up into above the elbow joint. Is that tender there?
Yeah.
So she's an 8 there too. And she's an 8 here. Where do I start? Well, we got a few more to look at. Remember I said the medial? I don't know. And for the medial, same thing. There's a common flexor tendon that comes in here, but I'm going to kind of go in, and it's okay to use your thumb, okay? It's okay. And then go in there. Are you tender there?
Yeah.
Okay, but let's see on this side. Let's see on this side. Are we tender over here?
Yes.
Deep breath. How tender over this side?
An 8.
An 8
That's
there.
not as bad when you go
An 8
down.
there too, okay? But her pain's over here. She's complaining of pain over here, but she's got an 8 over here. Remember we did that thing, and it's getting stressed there too, okay? Now, we found the extensor carpi radialis brevis. What's the one that's right now sort of more behind it, okay? The next one over. What's that one? Feel that one? Now, here, do this with your fingers. Just go like this.
Me?
Yeah. Oh, I can feel it contract. Okay? Your extensor digitorum. Okay? As a group. Okay? And then we can go below that one, and then we can hit her extensor carpi. Okay? Her extensor carpi as well. Okay? So, Typically, though, with tennis elbow, quote, tennis elbow, tendinopathy of the lateral tendons, we usually see two that get the most tender. It's this extensor carpi radialis and brevis, right here. Could be the common extensor tendon. Sometimes it's the lateral epicondyle, but it's usually like right off of there where the tendon kind of comes in and attaches. It can be anywhere along here. Okay? But if she's 99999 or 8888, where do we start? We're going to go right to the center. Because sometimes if I can find, not sometimes, often I find the most tender spot, the rest just release. And sometimes when I treat this side goes away. Sometimes when I treat this side goes away. Why? There's all kinds of fascial connections left to right through the elbow. We release that, it calms the elbow down. And we'll sometimes see it go away on this side, which is really fun. Doesn't happen often, but it's really fun when it does. Because we've now taken away the main driver that's sending information to her spinal cord and sending it to the other side. And it goes back and forth. Okay? Now, additionally, we said C6 gives you a clue. Gives you a clue. Everything in C6 now typically is innervated. So I'm going to go looking around for tissues that are innervated by C6, and our patients often say, well, how'd you know to go there? Well, your C6 is activated. Everything in C6 typically is going to be activated or facilitated.